So many questions, so many decisions to make. I'm here to welcome you to today's program. I'm Regina Smith. I'm Senior Services Manager here at West Tennessee Healthcare, and we are so glad to see you here today. I know you're going to learn a lot about the good, the bad, and the ugly of Medicare and the Advantage plans. We want to share that information with you and be sure that you have all your questions answered before re-enrollment time begins next month. At this time, I would like to introduce Anita Ruth Roark. Anita is the Director of Patient and Physician Satisfaction here at West Tennessee Healthcare. Thank you, Anita.
So good morning, and thank you to all of you who got up early. It would be early for me to come to this presentation today. First of all, we want to remind you that in the entry area, you probably saw a table that was set up. We have Kelsey Hagewood, who is the Tennessee SHIP Volunteer Coordinator. Tennessee SHIP is the State Health Insurance Assistant Program, and they offer free and unbiased Medicare information and counseling. So, and as a matter of fact, Kelsey is here. If you'll wave at everybody, Kelsey, she's sitting toward the back. So after we finish this presentation today, and we have a question and answer session, if you have additional questions, especially about the Advantage plans, you can talk to Kelsey, and she'll be glad to talk to you one-on-one. She has a degree in social work from Freed-Hardeman, and she's been with SHIP for about 2.5 years now. Now it is my pleasure to introduce our key speaker today. Pam F. Wright is the owner of the Wright Law Firm here in Jackson, Tennessee. Many of you are familiar with her and have heard her speak before. She is certified as a specialist in elder law by the National Elder Law Foundation and is a member of the Council of Advanced Practitioners of the National Academy of Elder Law Attorneys. Pam has been recognized for her work in legal issues that affect older Tennesseans and has received awards such as the B. Ronnie Green Statewide Advocacy Award, the Jane Kennedy Award, which recognizes outstanding contributions in promoting the safety and the well-being of older persons in southeastern Tennessee and the states. Pam graduated from the University of Tennessee at Knoxville, and she received her law degree from the Duke University School of Law. Please give Pam a big welcome. We are so pleased to have her today.
Thank you so much, Anita Ruth. Good morning, everybody. We're going to try to do a brief overview of a very complex subject, and some of y'all are going to know more about this than I do, so feel free to raise your hand or talk to me about a question. We're talking about, okay, let me see if I can do it this way. Okay, need to advance that slide, Chad, and I'm messing up here. Okay. Now, to talk about Medicare Advantage plans, you have to first start and talk about Medicare and understand that we're locked up. Why? There we go. Thank you so much. Okay. Little disclaimer. We're talking very generally about the rules here. Nothing can be taken as specific to your situation because every situation is different and there are a million exceptions to a lot of the rules that cover Medicare. Now, first you've got to understand Medicare, and if you're new to Medicare, you need to know that it's not like insurance you've had in the past. It combines the major medical concept of coverage with other ideas like preventive care, and it's broken up into pieces. So you have to get oriented to Medicare first. So outside, Kelsey has some of these, and if you're in Medicare or you're eligible to enroll in Medicare, you will get your own copy in the mail. This is helpful. The Medicare.gov website online is even more helpful because it's more detailed, much more detailed. Also, the SHIP program, which Anita Ruth has already mentioned, is really valuable because the SHIP counselor can talk to you about things specific to the state of Tennessee and to the area in West Tennessee. Obviously, the Medicare.gov website is talking about the program nationally. So some of the things that happen in Los Angeles are not going to be happening here in Jackson. You know, New York City, the plans and what's available there, very different than what's here. So when you want to really get down to it, local information is helpful. To help with that, Medicare in the book that you receive actually has listings of plans that are specific to Tennessee, not specific to West Tennessee, but at least it's state specific, and that's helpful. There's another book that I really recommend, and it's not sent out automatically. It's a collaboration between Medicare and the insurance commissioners of all the states, including Tennessee. And it's a how-to to understand the Medicare supplement policies that work together with Medicare. We call them Medigap policies also, and you've heard about them, and if you watch TV at all, you're seeing commercials for them every 15 minutes. This is a great booklet that has a lot of understandable information and charts and can help you, particularly if you're new to Medicare and so you're picking plans for the first time, or if you've been in Medicare for a while, you want to update, you want to revisit your plan choice and make sure it still works for you. Okay, let's talk about terms. When I talk about Medicare, I'm usually talking about original Medicare or traditional Medicare. It's what we all typically think of when we say the word Medicare, and that's when we get this red, white, and blue card, right? And on that card, it lists Part A and Part B enrollment. Sometimes people will enroll in Part A and postpone their Part B enrollment if they are covered by an employment-based plan. But that's different for every individual. There's not a general rule for that. Every situation is fact-specific to your individual facts. But that's the card when you go into the hospital and they say, we need your cards, you would pull out your Medicare card. Now, later in the presentation, we're going to talk about Medicare Advantage plans. That's how this was advertised. If you're in an Advantage plan, you don't use this card anymore. This is not the card you're using. An Advantage plan replaces original Medicare. And a lot of my clients don't understand that. They get very confused. They think a Medicare Advantage plan is like a supplement plan. So when they go to the hospital, they pull out their Medicare card and their Advantage card because they think the two work together, and that's not how Advantage plans work. So original Medicare is your starting point. And if you're new to Medicare, you need to start there. Learn about Medicare first. Medicare has different parts. And those of you that are already in Medicare, this is old news. Just bear with me for a minute. Part A is the big part that we think about because that's what covers hospital stays when you go into the hospital. I've had many clients over the years who started their health bills started building up, and they got really worried because they're on a fixed income. They were having trouble with bills. So they decided to drop their Part B because they said, well, it only covers doctor's visits. And that is dated thinking that is very dangerous. Part B is increasingly becoming one of your most important coverage parts of Medicare. Part B covers things like your lab tests, a lot of surgeries that are done on an outpatient basis, doctor visits, your supplies like wheelchairs, or if you're diabetic, your diabetic supplies, certain drugs, ambulance visits. Your bills under Part B can be really big. Part B is a valuable piece of the puzzle. So you want to have both Part A and Part B. That's important. Part C is the Medicare Advantage plan. Part C is not a piece that goes with A or B. It replaces A and B. That's a little confusing. The C stands for choice. because you can choose to get out of original Medicare and go into a plan that is run by a private insurance. Part D, and I bet everybody knows this, is your prescription drug plan. And Part D coverage, D for drugs, that's easy to remember, can be a standalone plan that you buy an insurance plan just for prescription drugs, or it can be combined with a Medicare Supplement plan or a Medicare Advantage plan. So once you know the parts, then the next thing to think about is, how do I supplement my Medicare coverage? Now, why do we have to even worry about that? Well, Medicare, I used to say Medicare is like a hospital gown. It covers important parts, but it leaves some important parts uncovered, right? Okay. There are deductibles, there's cost sharing, there are charges, what we call excess charges that may be above the Medicare standard rate. There are all kinds of charges that can come depending on the type of care you get. So, a long time ago, insurance companies developed something called a supplement plan. It does not replace Medicare, original Medicare. It supplements, it's an add-on. And the thought is that with Medicare and a good supplement plan, you would have pretty full coverage, very full coverage. And the great thing about supplement plans, the thing that I like about them, is that they're standardized. Congress, this is literally at the federal level, Congress came up with categories for these plans. So the plan that has the least amount of coverage is Plan A. And then it goes up B, C, D, like that. They skip some letters. It's not all the way through the alphabet. But you will find 12 standardized benefit policies, and they're labeled like that. Now, that doesn't mean there's only one policy of type A. There might be 100 policies sold by 50 companies of type A. So first you want to look at what kind of supplement might work for you. What would be your best choice on supplement? And then that's where your next step to make comparisons on shopping. Now, all of the policies, no matter what letter they're assigned, have to cover some core benefits. That's required by law. And then the higher levels of coverage will cover additional things. Core is going to be your basic hospital care, a lot around hospital stays, and the blood when you have to get transfusions. Now, this is like a core around Part A, not necessarily around Part B. So, and you see the different plan types there, and then the little dot is how they're covered. So all of them cover the core benefits. You see that there's two types of plans that cover a portion of some core benefits. And the bottom line part is Part B. That's the co-insurance with your physician visits and your other Part B services. And all of those types of plans, all of your Medicare supplement plans will cover that, though there's two that only cover a portion. Then you get into the additional benefits, and additional benefits are where you find home health services for skilled care recovery in a nursing home. Now, y'all are thinking, Pam, don't you know? Medicare doesn't cover nursing home care. And you're right. Medicare doesn't cover long-term care in a nursing home. Medicare does not cover long-term care in an assisted living. No Medicare does at all. Okay? Is everybody okay? But there are short stay periods of rehabilitation that can be provided in a skilled nursing facility, and Medicare Supplement can sometimes cover that. Medicare covers a portion of it. Depending on the type of supplement you have, you will either get no more coverage or full coverage for the 100-day period that Medicare covers a part of. Some Medicare Advantage plans provide no coverage for that at all. So skilled care, rehabilitation, home health services, those types of services, that's where you're going to see big differences between your supplement plans and your Medicare Advantage plans. So that's why I tell people when you're shopping, when people are shopping, they tend to think about, what do I need right now? So if you're new to Medicare, you're probably 65 years old. You might be younger than that, but you're probably 65 years old. You're a young person in the Medicare world. That's young. You may not feel that way when you're looking at Medicare, but it's young. And a lot of new Medicare enrollees are pretty healthy. They don't have a lot of medical things going on. In fact, they may have nothing going on. They may just check in with the doctor periodically, maybe have 1 or 2 prescriptions. And so you tend to view your insurance policy through that lens, and you think, I'm going to go for the lowest cost policy. And a lot of times, that's particularly helpful with Part D drug coverage, because if you're not using a lot of drugs, you don't want to pay for a big expensive plan that has more coverage. So this is what you have to think about when you're shopping. You're not going to beat the insurance companies. You're not going to come up with a fancy plan of beating them at their own game. You're not going to come up with a coverage where you make out like a bandit and they don't make a profit. Life is not like that. If you decide to take a package of Medicare coverage that is low cost month to month because you don't have a lot of needs right now, just remember that when you have a serious medical experience, surgery, some kind of medical crisis, you're going to have less coverage, because if it costs less on the front end, your coverage is less. If it costs more on the front end, you've got richer coverage. Now, that is not to say that the plan you pick right now you're stuck with for the rest of your life. That's not the way it goes. You can buy a Medicare supplement plan, and there are opportunities for you to change plans periodically. You can't do it just when you want to. It has to be during an enrollment period. An enrollment period is the time when you can join a plan, switch a plan, or drop a plan. And we're going to talk about those a little bit more. If you go into the Medicare Advantage plan, that's a little different. You have a trial period there where you could try it out. And if you don't like it, then maybe go back to original Medicare and shop around for a supplement plan. But once you get into a Medicare Advantage plan, you cannot necessarily go back to a supplement plan. You may lose your opportunity to use supplement insurance. If you're in a supplement plan, you always have the opportunity during enrollment periods to go into an Advantage plan. It just doesn't work the other way around. And for that reason, I often tell my clients who are new to Medicare, start with Medicare and a supplement plan that you're comfortable with, because Medicare takes a little getting used to. You have to learn about the different parts, how they work together, how your doctor bills, which doctors take what. So during the learning period, if you don't really use it very much, you're not going to learn much. And if you're in an Advantage plan and you don't really use it, your trial period is going to run out, and then later when you're a little more sick or you have some episodes needing medical care and you say, I don't like this Advantage plan, I want to go back to supplement, you may have missed the opportunity. So I always tell my clients, let's start with a supplement if we can afford it. Let's start there. You can always go to an Advantage plan later, but let's start with a supplement and see how that works for you, and reevaluate as you use it during the year or at the end of the year. An important thing about Medicare Advantage plans is that they are limited to service areas. They're all limited in some way. They may be limited to the state of Tennessee. They might be limited to 15 counties in Tennessee. So when you go through the Medicare book and you see the health plans at the back, not all those health plans are available for you. Some of them are only available in urban counties, the big four, one of the big four counties. Medicare Advantage plans work better in urban counties because they're more likely to have people signed up to be in their network. Now, what do I mean by service area? I mean that if you sign up for a Medicare Advantage plan that covers the county where you live, and then you move to another state, you have to change plans. That plan is not going to go to you for your usual and customary care in another state. Now, if you're visiting a friend and you have an emergency, the emergency room will call your plan and they'll try to work out emergency coverage. So one of the most important things that you have to figure out when you look at plans is there a limitation on your use of usual and customary medical services? There's going to be two limitations typically. One is service area, the place where you live and the place where you get your medical care. The second is something called a network, and you're going to run into that shopping for all the plans. Most of y'all know what a network is. The people familiar with that? I see some people shaking your heads. Thank you. Network are the doctors who have existing contracts with that insurance company for that plan, or the hospitals that have existing contracts. Now, here's a problem area. Salesmen will tell you that your doctor is in the plan. Do never rely on that. Absolutely do not. They can be mistaken. They could be just doing a sales pitch, or they may be saying it because if your doctor's not in the plan, there's no prohibition on the doctor coming into the plan, and you can go talk to your doctor and see if he'd be willing to take that plan. But that puts the burden on you. Like, you have to figure out, Doc, would you be willing to go in this plan? Would you call this salesman to come in and make that pitch again? Hey, join our contract. Most doctors don't want to do that. They have a time where they work on those negotiations, and then they want to get back to work. They don't want to renegotiate a contract every time a new patient asks about it. So never rely on that. If you are looking at an insurance policy that has limited network, it's going to be called an HMO or a PPO or a PFFS. If you're looking at that kind of insurance policy, then you call the doctor that you use. Call the hospital that you use. Call the hospital or the doctor that you might be using and would prefer to use. Find out if they take that plan. Nail it down yourself. The burden is on you. If you're going to find that there are a lot of providers in Jackson, Madison County who do not take a lot of these plans. That's why I'm warning you about it. I don't know how many times I've heard this story of somebody buying a plan and not doing their homework, not doing the legwork, believing the sales pitch. They get sick, they go into the hospital, not just a doctor's office, and find out they have zero coverage because if they bought a Medicare Advantage plan, they gave up their original Medicare. So they don't have Medicare coverage. And if their Advantage plan doesn't have a contract with this hospital, they may not have coverage there either. So they may go into the hospital with no coverage, zero. And that is scary beyond belief. A lot of times the hospital or the physicians associated will give you an opportunity to call the health insurance and they'll negotiate an out-of-network rate. And they'll get approval to go on and treat you, but it will be as an out-of-network provider. Your portion of that bill is always higher. That's the whole point. If you go to out-of-network, the part you pay is much higher than if you go in-network. So you may get some coverage, but it won't be what you expected. And if you're going to the hospital, odds are good you don't feel real well. And it's not the best time to be negotiating contracts for coverage. So just keep that in mind. That's the big, big worry that I have about shopping for people who have never dealt with Medicare before and aren't really used to the limitations out there. Now, when we talk about those additional benefits that are covered, this is just a quick chart that shows you that some of these are just kind of extras. They're not covered by everybody. But the ones that most policies cover of additional benefits are the co-insurance for the skilled nursing facility, that short-term rehab we talked about, the Part A hospital deductible, and your Part B annual deductible. Now, that Part B annual deductible that coverage for that is going away in 2020. So don't pick a plan. Don't make that a big factor in picking your plan. Half of the Medigap purchasers in the United States choose Plan F or Plan C. Plan C is less expensive and has less coverage than Plan F. Plan F is very popular. In Tennessee, Plans G and N are also popular. Just because they're popular doesn't mean they're right for you. No one size fits all in this game. Everything needs to be individual to you. But it's kind of helpful to know that, shoppers where they're kind of looking first. That gives you an idea to look at those. Now, there's a handout on the table outside. It's a Chicago Tribune article that comes out about changes that are coming down in 2 years about Medicare supplement plans. Read that if you're looking at a supplement plan, and that may influence some of the questions you have. Okay, so how does a Medicare Advantage plan work? We've talked about Medicare, we've talked about Medicare Supplement. Here's how it works. The Medicare Advantage plan combines your Part A and Part B into one plan, and it replaces original Medicare. So when you sign up for an Advantage plan, you are opting out of original Medicare. I know I've said that over and over again. I can't tell you how many people do not understand that. Okay, you can then purchase a separate policy for your prescription drugs. If you're in original Medicare, you can purchase a separate policy for drugs. Always try to do that when you're first eligible, because if you enroll in Part B or Part D late, you miss your initial enrollment and you put it off, you will pay a much higher premium because there's penalties that increase every year you delay enrollment. So never delay enrollment without getting individual advice. If you're delaying enrollment because you currently have coverage through an employment-based coverage, talk to the administrator of that health plan. Talk to them and talk to your Medicare counselor. I know cases where people got conflicting information and one of those people was wrong. So talk to both and make sure they're telling you the same thing. You will be protected against late enrollment if you are in the right type of health insurance, but not all health insurance protects you from late enrollment penalty. So you have to check that. Now, so you want to get Part D as soon as you are eligible to get it, and you don't have a exception. You need to do that. If you don't have prescription drugs that you need to get now, buy a low cost Part D. That will keep you from being penalized. It's not a big premium, and then the next enrollment period, you can bump it up if you need a different plan and you have more prescription drug needs. Anyone sitting in this room knows that prescription drug costs are becoming increasingly a big part of our medical cost. So Part D is really important. When I picked a plan for my husband, I started with Part D because prescription drug coverage was a big thing for us. You literally can go in, to Medicare.gov, this page. You can literally go in there and set up your own account. Enter every drug that you have prescriptions for. They will give you an estimate let you rank the policies and compare them, and you can rank them by price, you can rank them by quality ratings, you can look where they're located, you can see what pharmacies are in network, because pharmacies are just like doctors and hospitals. They're either in network or they're out. Then, when you look through this, pick some of your favorite plans, and who do you talk to next? Your pharmacist. Just like you would check with your physician practice or your hospital, verify that your pharmacist takes that plan and find out if the pharmacist experience is a good experience or a bad experience with that plan. Some plans will cover all your drugs, but within that coverage, they're going to have a lot of conditions on coverage. They're going to require pre-authorization. They're going to require what's called step therapy. This is big in blood pressure plans. The plans will want you to start with the cheapest blood pressure drug, and if that one doesn't work, then they want you to try another one, and they won't do the good one that you've had good luck with until you have shown that the other ones don't work for you. And that can be miserable, really miserable, having to go through drug trials with drugs you've already tried and they didn't work. So a lot of times you have to get with your doctor, and he has to do a lot of paperwork to say, we've already done this step therapy. We tried this before he was on Medicare, and we need this particular drug. So that's why you talk to your pharmacist, because the coverage may look great on paper, but in practice there may be a lot of barriers to good coverage. So do the list, look at the plans. A lot of it is DIY, but always check with a SHIP counselor, ta-da, with an independent insurance broker if you're willing to pay for independent advice, not somebody who's getting a commission. Talk to somebody that represents more than one company. If you want to do that, always check with your providers, no matter what. It's just a big thing. Once you're in Medicare and you've used it and gotten used to it, you will be better at designing and picking your own plans. But if you're new, it's a lot to absorb. Okay, then when you decide about the Part D and what you're looking at, then look at either a supplement or decide what kind of Medicare Advantage plan you want to think about. You can combine Part D with those plans. You don't have to get a standalone Part D. So sometimes you'll find a supplement plan that has good drug coverage, or maybe you're not worried much about drug coverage and you're just going to go on and take that supplement plan so that you can enroll in Part D early. The Advantage plans come in 2 flavors. I mean, they actually come in 100 flavors, but generally there's a low-cost plan that's called a value plan. Those premiums are going to be very low, but it's a value plan. The coverage is very low also. So if you're in a value Medicare Advantage plan, it's highly likely that you will not have coverage in the event of a big medical event. Highly likely. It's also likely that your major providers will not accept that plan. Then they have something that the industry calls a supplement killer plan, because it's a premium plan. The premiums are higher, the coverage better, and it can compete more effectively head-to-head with the supplement plans. Okay, if your income is low or near poverty level, it doesn't have to be at poverty level, there are some other things. There are programs that will give you the same coverage or a piece of the coverage that we're talking about today that complements Medicare. So if your income is in these ranges, you definitely want to talk to your SHIP counselor and let her review your information to see if you're eligible for free coverage that's subsidized by the government, low income. If the income is the big piece that you need to look at, if your assets are too high, they might be just a little too high, you can talk to a legal services attorney or an elder law attorney like me, and we can usually advise you with very little time used about how to restructure your assets if you really need to get into these helpful Medicare Saving and Extra Help plans. I have had so many people who were like 2,000 over the asset test, and I would say, okay, what can we do to get you below assets? Are there some things you need to do? And they'll say, well, this is all the money to bury me. I'm holding on to this money because I need burial. And I'm like, well, if you'll go on and do a prepaid burial, you're going to be eligible for this and have your burial. So you'll have your cake and eat it too. And that happens quite often. So just keep that in mind. Okay, I talked about enrollment periods. Enrollment periods that's when you can join a plan, switch a plan, or drop a plan. You can't do it just any day of the week. It has to be at particular times. This is overly generalized. When you look in this book, there is also simplified information about enrollment plans on page 77 for Medicare Advantage, on page 87 for Part D. The trial period for Medicare Advantage is on page 84. And there's information on here about your enrollment periods for Medicare Part A, Part B, and Part D. Okay, each one of these pieces has different rules about enrollment. Crazy, I know. That is just crazy. You have to look at that and have to figure that into your calculation. If you enroll in a Medicare supplement plan, remember I told you that you can always go to an Advantage plan from that. If you enroll in a Medicare Advantage plan, you might not ever be able to get a Medicare supplement plan again. Well, for that reason, there's a trial period with your Medicare Advantage plan. So be real cool about looking at that trial period, because that's your opportunity to say, oh, I don't like this plan after all. Or if you didn't get everybody called and you went on and bought the plan, during the trial period, make those calls I just told you to make. Call your doctor, call the hospital, call the cancer center, call the dialysis center, whatever you think you might be using, call, find out if they're in that plan. If they're not, you've still got an opportunity to make a change, okay? Now, the other thing I want you to do when you're shopping for these plans, I want you to imagine, I can't tell you, I'm close to Medicare age. I'm sure y'all are shocked looking at me. You think that I'm years younger. I know. You're probably shocked that I'm not already in Medicare. I got that. But I have so many friends who are close to getting in Medicare. And they know they're going to need a knee replacement, or maybe two. They know they're going to need shoulder surgery. They know they're going to need a hip replacement. They already know this. Their doctors have told them this is in your future and not too far off. And they're all putting it off until they're in Medicare. Right? A lot of people are doing that. So when you're shopping, imagine, okay, let's say I get those knees done. Where am I going to have it done? What do I have to do for rehabilitation? Who are going to be my physicians? Are they in the plan I'm looking at? That's a big test. And what is the coverage of those plans? Some of those Medicare Advantage plans are not going to cover you at all, or only at a minimal level. Some of the Medicare supplement plans are not going to cover, and you'll only have your Medicare coverage. But your Medicare coverage is better than no coverage. So that's another test that's easy to do when comparing plans. Okay, I'm stuck again. Uh-oh. I'm talking too much. Yeah, that'll do it. Yeah. Now, you'll hear people talk about guaranteed issue. That's the concept when I say you can't get into another plan. Guaranteed issue is a period of time when the insurance companies have to issue you a plan. They can't say we're turning you down because of your age, because of your pre-existing condition, that kind of thing. That concept goes hand in hand with the enrollment periods. So again, getting started, a good way for you to do your homework is to go online, if you can, and actually enter some of the information. You can do a general search or you can do a personal search. A general search is going to be general information about your zip code. I live in Beach Bluff, so when I enter my zip code, it wants to know if I'm in Henderson County or Madison County. I don't know why that matters, but for some plans, apparently it does. Yeah, interesting, huh? So if you're in three-way, same thing, you know. So you enter your zip code. That's how, even though it's general, it gets down like that. Or go ahead and go into the personalized section, set up a Medicare online account so that you can work on it, step away, come back, go back in, work on it some more. If prescription drugs is a big issue, start with Part D, because that's going to really narrow things down. If you want a certain pharmacy, if you have a certain kind of drug that not many plans cover, that's going to be one of the first things you look at. And then you'll be able to compare if you want a combined plan or a separate plan or how you want to go forward. This is what I recommend. This is me. These are not general rules for everybody. This is not coming from the hospital. This is not coming from Medicare. This is coming from one person, just one person. If you travel a lot and you have ongoing needs for prescription drugs or occasional doctor's visits, stay out of Medicare Advantage plans because you're going to end up in Montana and no coverage and you need to have your prescriptions filled, or you've got to go in for an unplanned doctor's visit. So if you travel a lot of younger Medicare enrollees do. Stay out of Medicare Advantage. If you know you're going to be moving in the next few years. My brother thought he was in one place and he was going to be there. They ended up moving unexpectedly, especially if you're moving to be near family or if you're 65 and you're still working. How's that going to change things up? So if you know you're going to be moving, if you anticipate surgery in the near future, remember what I said about you're putting off that knee surgery, stay out of Medicare Advantage plans. If you have a large number of prescription drugs, stay out of Medicare Advantage plans. That's my recommendation. Now, one of the things that Kelsey reminded me about that you can do, if you start with a Medicare Advantage plan, if you start with a supplement, if you buy a supplement, but that Medicare Advantage is still tweaking in your head and you're thinking, I could really save some money with that. If you have a supplement and you've had it for a little while, they have a guaranteed right to suspend the policy, which means you don't pay premiums during the period of suspension. It's a time-limited right. If you decide you want to go back into the policy, you can during that little suspension period. So that's now, not every policy has all these rights. If you are buying certain group policies, they may not be covered by these rules. So that's something else you want to check into. If you're shopping with Farm Bureau or AARP, they may not have the same rules as plans that are regulated by the state insurance commissioner. When you're looking at prescription drug coverage, I know almost everyone in this room has heard of the donut hole. The donut hole combines a basic prescription plan with a catastrophic plan. And in the middle, there's a big hole. So if you have enough in prescription drug costs, you will have one kind of coverage. When you use up that coverage, you will go into the donut hole and you will have zero coverage under certain plans. And then if you have catastrophic prescription drug needs, meaning you have really heavy use of prescription drugs, then you go into a catastrophic plan where the coverage is actually very good. So plans are allowed to merge all of this together and pick and choose. So sometimes you'll shop a plan that provides a portion of coverage in the donut hole. That's why those online calculators can be so helpful, because it allows you to actually project your use of your prescription drugs, the cost, and how that's going to be done between the basic plan, the donut hole, and the catastrophic coverage. Remember that every single plan has a formulary. If your drug is not on the formulary, it is not covered. If your drug requires prior authorization or it's limited to how many times they'll fill it, your pharmacy is your best source for that information. Personalized search, I highly recommend it. Okay, quickly, Medicare Advantage plans. Let's get to our theme music. What's the good about them? Predictable on short-term costs. When you get into them, you know you're going to be paying a set amount each month, absent a medical event that is unplanned. If you are a low utilization consumer, which means you're pretty healthy, you're not using a lot of medical things, that can be very low cost, and that's helpful. Most people love that it simplifies the consumer's paperwork on a day-to-day basis. When you use it and you've got Medicare sends you an explanation of benefits, which is called an EOB. Then your Medicare Supplement sends an EOB. And it takes months to get these, and that's when the doctor tells you how much you still owe, and it's horrible to put together, and I hate it as much as everybody else. Medicare Advantage plan simplifies that tremendously, and most people love that. The only problem is when you're really sick or you have an emergency, and then you're not covered by in-network, out-of-network, all of a sudden all that simplicity blows up. Also, these plans may offer extra coverage that regular supplement plans and Medicare together don't offer. And that's a big piece too. Okay, what's the bad? Your normal use of services is limited to a service area. That may work for you, but make sure it does. Services that are covered as advertised are only in network. Out of network use is an entirely different thing, and you have to investigate that. Network limitations may be misleading. And let me just say that some of the plans out there that are low cost are called PFFS plans. PAM, not the hospital, not Medicare, just PAM says avoid those plans. PFFS are not good plans. They will tell you, any doctor you want to use is covered. That is not true. And you can verify that with any physician and hospital that you use. No predictability for long-term costs is a big factor with Medicare Advantage plans. Higher costs, confusion of plan rules can be a problem, not when you're young and on top of this, maybe, but later when you're sicker or when you're having to manage a lot because you're juggling a lot of medical visits. The ugly is your favorite provider may not be in that plan or may drop out of the plan while you're in it. They may be in the plan when you enroll, and come May of 2018, they are no longer in that plan. If your provider is not in the plan, you have zero coverage. Your Medicare does not cover it. Or you have to have the provider negotiate out-of-network cost, which will be a bigger cost to you. That's the ugly. And that winds it up. Here's your choices of the combinations that are available. And within each of these combinations, from 2 down, there are dozens of plans. So there's way too many choices. You can start by looking at the combination that works best for you, then compare the individual plans. Do your homework. If your hospital or doctor is not in provider network, don't start with that plan. Just don't do it. It doesn't make sense. And there's a lot of resources out there. I hope I've gotten you started on some. Thank you very much. Any questions? Yes. Uh-oh.
And now you got me totally confused.
Well, I've done my job. I've confused somebody beyond belief.
In my particular case,
Yeah.
my previous employer gives me about $400 a month.
Mm-hmm.
And I can take that money and buy different products with it. we're recommending this year, excuse me, is an Advantage plan, a Medicare Advantage comprehensive plan, and the Medicare Advantage core plan. They don't even mention not taking any of this and only going Medicare. And you're saying Medicare in some cases may be better
No, I am not saying Medicare by itself is better. No, no, no.
with a supplement.
Medicare with a supplement may be better. It's definitely worth comparing. Find out if your employer will even allow your health dollars to be used that way, because they may have a tie-in with a particular company. Yeah,
My concern when I talk is, of course, it's managed by United Healthcare.
yeah.
And I know United Healthcare probably has different policies for different individuals or different companies.
Yes. United Healthcare has both supplement, Part D, and Advantage, a full range. Blue Cross, same thing.
I know that when I talk to, in fact, they're open 7 days a week, 24 hours a day, now that you can call them. My concern was, if I take the one with a no copay, do I get the same coverage as if there is a copay? And he said, yes, the coverage is the same, except the fact you're paying the copay. So what I need to do is go back to United, well, I guess United Healthcare, but my employer, to say, can I take that money and do something else with it?
Find out, how you can use your employment health dollars. And this is a common question. People's retirement plans may be tied in to the company that their work insurance has been, or the company may have done a favorable contract with a health plan for their retirees. So that gives you a whole different set of options than the person who is just shopping from their own pocket. But you still have to make comparisons and choices for you.
You have complicated my life.
I am so sorry. I just remember when I was pregnant with my second child and my husband changed jobs in the middle of that pregnancy. And all of a sudden, I was in a limited service area, limited network HMO that did not cover my gynecologist. Okay. And I had to, make that adjustment and that kind of thing. I was not happy about it. That happens to everybody, whether it's regular insurance or Medicare. You just have to plan ahead as best you can. Yes.
Next question may not be directed to you, but so you mentioned, does this hospital accept my new coverage?
Good question. Who would they talk to? Bill Jones is here, and he might want to answer that question. Is this a good time for us to bring people up? Okay. Any other questions, General? Yeah.
Yes, is your PowerPoint available to us?
I didn't print it out. Most of the information in it is in the materials that are at the front desk, except for my recommendations, if you made a note on that, because that didn't come from Medicare or SHIP or anybody. Yes.
I'm concerned, I've passed that 65, and I've opted not to take Part B because I'm on my wife's insurance.
Right.
When she reaches retirement age, I'm gonna have to do something.
Yep.
Am I gonna get penalized because I have waited?
I don't, generally, if you have waited to take your Part B because you were on employment, generally there's not a penalty, but that is not true in every case, and I can't answer your individual question because some employment does not meet the criteria for Medicare, and in fact, you will be penalized. If your health plan administrator told you that and it matches what Medicare says, you're fine. But you've got to check both places because sometimes one will get it wrong. I've had Social Security tell people wrong, I've had Medicare line tell people wrong, and I've had health care plan administrators tell it wrong. Yes?
Yes, if you already on original Medicare, why would one selected go into Medicare Advantage?
Well, he asked if you're on original Medicare, why would you choose to go into Medicare Advantage? Typically, people will do that for two reasons. One, they don't want to keep paying the Medicare supplement price, and they're looking for a way to bring that down, and they think that's the way that might work for them. The other is that they're just overwhelmed with the paperwork, and they like that pitch about one plan for everything. It just, there's just more to it than those two issues. Good time for me to stop. Go, Bill.
Yes, sure.
Thank you.
I'll add one other thing to that
Yeah.
while you're here. One of the things I've seen on the Medicare Advantage, in the Medicare Advantage arena in the past few years is, the MA plans offering what they call a zero premium plan. Have you
Yeah.
seen some of those? So, on the surface, that sounds very, very attractive because it says zero premium, like you have no premium, but you have to look at the full picture and your out-of-pocket expenses and the copays and deductibles and everything. But that's another reason, I think, to answer your question, if somebody came and presented a plan that says you have no premium, your initial reaction is probably going to be, well, that sounds great. So that would be another, that they do things to make the plans look very attractive. Let's put it that way. Very, very good point. Did y'all hear that? So if you're on a zero premium plan, you're still responsible for paying your Part B Medicare premium. So you never really have a $0 premium. Back to your original question, on United, we are not contracted with United. West Tennessee Healthcare is not. West Tennessee Healthcare is only contracted with United for what's called a special needs plan. And I don't know that we want to get too deep into special needs plans, but it's for people that are dual eligible for both Medicare and Medicaid. So that's the only United plan we're contracted with.
So if I understand what you're saying, just to put it in my words, if I choose to go with either one of these Advantage plans, and I have a group number that I'm covered under, they're gonna manage my, healthcare through United Healthcare, but you guys don't participate in United Healthcare,
Correct.
so I'm just out of luck.
Well, depending on the plan, what your out-of-network benefit is. You could have some out-of-network benefit or you could have zero, depending on that particular United plan. If it is an out-of-network benefit, Pam mentioned this earlier, we do have processes where we'll work and try to get case agreements with them at times when they're willing to work with us. But you would be out-of-network, and you're likely going to have higher out-of-pocket costs associated with that. A higher deductible. I'm sorry. All right, so I do have I've prepared something that lists the plans that we do participate in. I'll read these off quickly, and then I'll make this available at the back if for those of you that are interested in Medicare Advantage plans after discussion. We are participants with HealthSpring, who's now owned by Cigna, Humana, Blue Cross Blue Shield of Tennessee, and then United for the dual complete plan only. I list that because it is technically a Medicare Advantage plan, but it's for a very select population when we're talking about the special needs population. So those are the plans that we're participants in. Bill Jones. Yes, sir, Bill Jones. And when you look at the Medicare statistics, these are the major plans that are in our market. WellCare is another one that we see periodically, and they also go by the name Harmony. It's the old Windsor. If any of you were ever part of Windsor, we've been non-contracted with that plan forever. We've never had a contract with them. So we're non-participating with them. They have reached out to us. There have been contract discussions in the past and some even recently, but currently we're non-contracted with them. So that would be one that we can see has a few members in our market that we're not contracted with. The CMS statistics, Medicare is really good on the Medicare is good about providing Medicare Advantage data. You can look, go on the CMS site and look at Medicare statistics by county and see what plans people are in this county. Yeah, it's a ton of information, but you can go into that website and pull up Madison County or any county around us and see who's enrolled in what plan. So it's CMS. It's the CMS.gov site. CMS.gov. You can do a search for Medicare Advantage statistics and it'll pull it right up. Yes.
Bill, when you say that the hospital is not contracted with certain plans, does that extend to all of West Tennessee Healthcare?
Yes. We contract as a system when we contract for West Tennessee Healthcare. You get all the hospitals and all the providers, or it's typically an all or nothing agreement. So, but that would include Milan, it would include Camden, Bolivar, all the hospitals would be non-participating with those. And going back to what Pam said, or just one other piece of that. The Medicare Advantage plans have to go typically county by county to get approved to offer their products. And they have to go and present that to CMS by February or March of the prior year to get approved to even offer a product in those counties for 2018. So you shouldn't be offered a product in Madison County if you live in Madison County that's not approved to participate here. But there are some regional approvals that come into effect at points that where plans get approvals for an entire region. But typically, if a plan's being offered to you, they've been approved to offer a product in that market by CMS. I am the Director of Managed Care Contracting, so I handle the department that facilitates the contracts with payers and Medicare Advantage payers and commercial payers as well. So, any other questions about that? Yes, sir.
I came in a little bit late. Was contact information given for representatives from the SHIP plan?
Kelsey's here.
Okay, it was given earlier.
Kelsey's here, and she's got a table out front as well, and I guess you'll be back out there after we get done here this morning? Okay, all right, thank you. I'll make this information available on the tables as well for the plans that we participate in, if you're interested in that, and you can let me know. I'll stick around a little bit afterwards, too, if you have any other questions. Thank you.
So let's thank Pam and Bill and Kelsey. We want to thank you all for being here today. We're sorry we put you into a tailspin, but not really, because we want to make sure that you get the plan that is most appropriate for you. It is confusing. We've had a great discussion today. Again, if you have some questions, you can talk to Kelsey after, and I'm sure Pam will be here for a few minutes as well. Thank you all so much for being here today.